Yes.
Okay, so good and bad about both. I'll talk about both. The good thing about a shave is a shave kind of takes it off at the level of the base of the lesion, so it kind of leaves a patch. So it doesn't look like a kind of classic scar. Like a classic scar is like a line, so it's kind of like a patch. So that's good. The bad thing about the shave is if it's pigmented, if it's brown, sometimes the pigment goes deeper than the shave. So you end up with a flat black brown thing, but yours is skin colour, so that's good. The risks with the shave, the bad things that can happen with the shave is you can do too much or do too little. Always try and make it perfect, obviously, but sometimes you do too much, you get a dent. You do too little, there's still a bump there. There's stuff you can do. So if there's a dent, you can always excise it, like the other option. And if there's a bump, you can always do another shave. The other option is an excision. An excision means kind of cutting it out and stitching it up, kind of what most people probably think is normal for a mole. The good thing about that is that it gets rid of it all, so the pigment hairs and all that sort of stuff. Either way, we send it off to look at it under a microscope to make sure it's all benign. But as I say, clinically they look benign. And sometimes people like the thought of an excision because it's kind of removing all, so they psychologically like the thought of that, which is fine. But it gives you like a line, which is a little bit more obvious.
I'm happy to have them all shaved, as long as you think that that's doable for them.
Yeah, I think it is doable for them. Yeah.
Okay.
Still a bump here, a little bit here. So chamfering the edges, tidying the edges is actually more challenging than the main one because it's flatter.